Hello, welcome to our YouTube channel.
My name is Dr. Chi.
And I'm Dr. Sacha.
And on today's episode is
Ask the Doctors. We'll be answering your questions that all you guys have submitted. Let's dive in for all the brainstorming.
Yeah.
Okay, question number 1.
Why don't you guys respond to DMs?
Instagram is not the best way to contact us, and we have other ways. You can call the clinic directly, but
Yeah, can call us. We have WhatsApp numbers too.
there's a website to book appointments. Those are better ways to find us. DMs, it's too much DMs to answer. We try our best, but we may skip a few.
And the clinic numbers are open between 10 a.m. to 6 p.m. daily, except for Sundays.
What are the best options to get rid of ingrown hairs, facial hair?
Okay, so these are basically two different questions: ingrown hair and facial hair.
Yeah.
Let me start with facial hair. Okay.
Okay.
So for facial hair, there are multiple ways you can get rid of them, but our preferred way is just to do the laser for reasons that I'm going to explain later. But some people choose to wax, and waxing can also lead to the first one, which is the ingrown hair.
The ingrown hair.
Better.
Yeah.
Okay. So, but our preferred way is to do the laser. And Dr. Sacha, can you just tell about it?
Yes. I mean, all facial hairs, like Dr. Chi said, you can remove with traditional ways are waxing, shaving, threading, but laser hair removal is the best. It's the most modern, that's first of all. And second of all, it removes the hair semi-permanently, so it's best, and you avoid ingrown hairs, which is the first question. By shaving or waxing the hair, it is cut out a way that the hair can curl back into the pore. So preventing all of that, it's best to just remove it with laser and be done with it. So we answered both actually in one question.
Yeah. What skin routine is used to fight hormonal acne?
Well, hormonal acne is just like the name say, hormonal. So you need to control the hormones first. There's not a routine specifically for hormonal acne. There is a routine for acne, and then if it's hormonal, you really have to treat the hormones from inside.
Rather, I keep going back and forth trying to control that.
Exactly.
So do you treat 16-year-olds for acne?
Yes. Now, why? Because if we don't treat her, she's going to go to Instagram. So,
We don't want that happening.
Yes. But of course, there are some things we would avoid giving a 16-year-old that we could give an adult.
Because she's still growing.
Because she's still growing.
She's
And you
still
know
growing.
what? There are products developed specifically for teenagers for their acne issue, because teenagers do have acne. So there are a lot of products designed specifically for teenagers.
Yeah.
Now, scientifically, the treatment of acne is kind of like the same: salicylic acid, benzoyl, So we tailor that. Then we consider the age of the person in prescribing the exact thing she would use. So yes,
we do treat, and mostly we use a good skincare routine for them. So we're not going to be doing the hyperfalutin things of lasers or chemical peel, because I'm sure we keep that for
simple.
For
we
later.
keep it
We keep it really
simple for
simple.
teenagers. Do you have a branch in the US, or can you recommend any in the Maryland area? No, we don't, but we do have some people that carry our treatments in the US. So if you know why exactly you're looking for a branch in the US,
appropriately.
yes, and we have online consultations, remember. So even if you're in Alaska, we can talk, we can prescribe products for you to use, and then we can tell you where in the US you can get treatments. So.
Yeah. I will be flying in from the US for my Clarity Pill, so I cannot assess the preparatory protocols or products. All right, so like she said, we do have online consultation. We recommend, if you're out of town, you do your online consultation. This will afford us to understand your condition and put together a treatment routine for you. You, however, cannot do a Clarity Pill or any pill without being prepared. the skin could go into shock. So usually we want you to have a period of preparation before you do your clarity peel. Otherwise, you'll be jeopardizing your result.
Okay, next question, please. How long after clarity peel does the skin begin to peel? Basically, this varies from client to client. Okay?
Yes.
For some people, it starts 2 days later. For some,
Yep.
the 3rd day. Some, the 4th day.
Yeah, I've had people that it started 2 weeks after. They were like, oh my God, I did not peel at all. This peel did not work. And then 2 weeks later, boom, it's shedding. So it varies from person to person. But what I think it depends on your skincare routine. So the more advanced your skincare routine the more delayed the peel will be, because there's less work really to be done. Differently than someone that has not been doing anything at all, and then the dead skin is right there ready to shed. So it really varies from person to person, from your lifestyle and from your skincare routine. Hello, please, how much will it cost me to remove eye bags? Oh, let me do this one. Okay, eye bags can only be removed with surgery. No matter what you hear, no matter what you read. Under eye hollows, it's different than eye bags. So you guys need to make the difference between eye bags and under eye hollows. So eye bag, it's only surgery. We don't do that really at the clinic, but
You know, some people are scared to go under the knife, and some rather want to have fillers done to camouflage that.
I think it will look worse when you add fillers to bags.
Yeah.
So I always tell them the only way is surgery. Like if you don't want surgery, then stay with your bags, I guess. But really, eye bags can only be removed surgically. We don't do it at the moment, but I'm trying to train for that. It's called blepharoplasty, by the way, the surgery. And I will be training in that very soon.
I've done more than 15 chemical peels. I still have acne. I need help. So basically, 15 chemical peels, that's strange.
Well, first of all, that's a lot. It's a lot of chemical peels. But that's not the solution to acne. You need to treat acne from inside. People, you need to understand that. So you can do 100 chemical peels. The chemical peel will treat your texture, it will treat the complexion, it will treat the surface of the skin, but you have to go where at the root of your problem. Yeah. So people do chemical peels, yes, but it is most likely added an add-on treatment to their medical treatment. If you're not treating the acne medically, you're doing chemical peels for no reason. So
basically understanding the cause of the acne.
Exactly. Find out which type of acne you have first and tackle it there. The chemical peel is mostly to add on to the medical treatment. Acne is still a medical disease.
Is it okay to use both a BP wash and a BP cream in the same routine?
Yes, definitely. It depends on what your esthetician or your doctor has evaluated for you, the kind of acne you're suffering from. Most time, I would recommend you wash with the BP wash, and then you spot treat with the gel. It will help a lot. So yes, you can.
I want to work in your clinic. How do I apply?
Do you have experience? That will be helpful. You can apply. Just go to our website.
So easy.
Send us an email,
apply.
and then send us a CV, and we will conduct an interview.
Yeah. So
we welcome anyone who has passion in this industry.
Apart from the UK, are you situated in other European countries?
Not yet, but we're working on it.
Well, there is a treatment we offer, Clarity Peel. You can get that in France. So, depending on where you are, which is why we always recommend that you do an online consultation, and then we will recommend the best place to go to for treatment.
Please, what can I use to remove sunburn and really dark circle?
So this is basically 2 questions in one: sunburn and dark circle.
Well, these are 2 different things.
Mm-hmm. So basically, some people here in Nigeria refer to melasma as sunburn.
Oh, well, that makes sense because melasma does come from sun exposure. But it's not a burn. It's not a skin burn.
So how can they remove that? First of all, like you said earlier, they should try and avoid the sun exposure.
Yeah.
And secondly, they should have a skincare routine that include SPF. Here in Nigeria, I always tell my clients to go for, if possible, SPF 50 and above. Okay. Mm-hmm. but 30 SPF 32 isn't bad as well.
Yeah.
And then
The best sunscreen is the one you wear. That's what I always
you are
tell
able
them.
to wear regularly on
yes.
daily basis, right?
So don't really focus on the number as long as you wear it. But yes, of course, 50 and up is better.
I've had cases where clients tell me that they could kind of wear or apply sunscreen under their eyes to help with sunburn.
I apply under
or
my eyes.
any dark circles.
Yes, I apply under my eyes. When I apply my sunscreen, I apply everywhere. Face, you have to extend it to the ears and the neck. Those are places that we forget as well. And those are places that get hyperpigmentation. Do you do FUT or FUE? Both are hair transplant methods. FUT it's called a strip. And it's when you remove a strip of the skin and then you cut out the follicles manually. FUE, you use a machine to extract it follicle by follicle. So both of them are done. These days for black skin, we tend to not use FUT just because black skin tend to keloid more and the scar in the back is not very pretty. So FUE is preferred.
I have a darker forehead due to years of exposure to sun without SPF. Can Clarity Peel fix it? Definitely, Clarity Peel can fix it.
Yes.
So basically, the first thing you have to do is to get an appointment with us, and we can guide you on the necessary process on how we can prep you and book you for the appointment as well.
Yes. So it's not just Clarity Peel. It's a whole
Process.
it's a whole treatment.
Is male skin very different from female skin to the extent that they require different products? There's an interesting question.
On the surface, no. On the surface, I would say no. Skin is skin. What I find with male skin is because they don't really take care of their skin, their issues are, should I say, more
intense.
Because I have a male client with hyperpigmentation. My God, I've tried a lot of things, and yes, it's getting better. But whereas a female has probably used over-the-counter products and some things, he has never used anything. And they always go out without protecting their skin from the sun.
They most time don't even have time.
The only difference I'd say is maybe the beard area could be different. They are more prone to having PFP, But otherwise, skin is skin.
Yeah.
Do you need to reapply sunscreen on the body every 2 hours?
Okay, so it depends on the specification on the sunscreen. Some are for longer, some are for 2 hours. And depending on your exposure, if you're out in the sun, it is advisable you reapply according to the manufacturer's specification.
Is it possible to remove spots, brown marks on the legs? Any plans for Port Harcourt? Like we always say, we have to do a consultation.
We need to understand where the
Yes.
issue is coming from. Then we can advise
Then
accordingly
advise.
because there are different modalities for removing spots. Lasers, peels, microneedling, different modalities. So
And for Port Harcourt, well, our plan is to get to the end of the earth.
Can't find the place to book for Abuja on your website. Do you treat dark underarms? Yes, we do treat dark underarms. And for the Abuja link, I think we have a little issue with that. We sincerely apologize for that. You can just call the clinic and you'll be sorted out, okay?
If I get at-home peel for hyperpigmentation, would I still need to come to the clinic? Well, at-home peels are never as potent as clinic peels. The answer is yeah. It's whatever you want.
Definitely, you have to come to the clinic.
You would have better results with in-clinic procedures, but yes, you will also see results with at-home. Can I get to be treated in your clinic in London? Yes, everyone is welcome at any
time.
At any of the clinics worldwide.
good morning or good evening. Please, my face is always reddish. What can you recommend? We need to understand what is causing the reddening. So you need to come in. Is this something you're using? Is it something that's irritating you? We'll need to assess. We can't just recommend without seeing you.
Does Rejuva lighten up the face and fade sunburn? I got 2 shades darker after my NYC.
All right, we won't advise that. We will advise on the contrary that you should get a proper evaluation done and then Rejuva could be added into your routine to get your skin back to where it was
Yes,
before.
I get a lot. I get a lot of that. Honestly, everybody just wants to just buy Rejuva.
Buy Rejuva.
Lights and all, but Rejuva, it's more than that. You know, it's part of a treatment most times, and it comes with prescription most times, unless you're buying a refill. So I'll advise you get a diagnosis, get a consultation, get diagnosed, and get the right routine
in place,
in
because it will
place.
serve you in the long run.
What treatment can be done to a symmetrical face? Well, there is something called facial profile balancing, and we use a combination of treatments, mostly fillers, but it's possible. So it depends on what part of the face is not aligned. But as usual, we'll have to assess to know what exactly to do.
What's the best treatment for hormonal nodular acne? Topicals like BP salicylic acid did nothing for me. Well, that's because you didn't treat it at the root, which is the hormones. Yeah, so topicals they will treat the surface of the skin, but you need to go right at the root of the problem, which is your hormones. So you need to get a medical hormonal treatment.
So basically, she's trying to say it's multi-modal factors come together to help tackle that.
A lot of people do make the mistake of just going to a pharmacy and buying things over the counter and trying to treat themselves. If that's what you're doing, you're wasting your time. You need to see a professional, see a dermatologist that will give you a treatment, a proper treatment, and then you will support that with the skincare that you buy. Okay, we've answered most of your questions now. Thank you for submitting them. This was fun, right?
Yeah, it was.
This was fun.
And if you enjoyed our YouTube video,
Subscribe to the channel
click on the like button.
and follow us on Instagram.
Yes. All right.
Bye.
Bye.